Okay, so for those of you who are doing this for the first time, you're standing facing their head, find that little notch there in the thyroid cartilage, then come down and find the inferior edge or border of the thyroid cartilage, so you know you're in the right spot. Then from here, the notch, come up on either side and try to find the hyoid bone. You have to spread your fingers fairly wide, come up just right underneath his jaw here, and then once I think I'm on it, go ahead and have him swallow. Should move up out of your fingers and then come back down. Then find the thyroid cartilage again, come all the way to the inferior edge, come right off of it until you're on that first cricoid ring. And then go to the very lateral portion of that, about an inch lateral, and try to find the carotid tubercle. Once you feel like you're on it, then just pause and see if you can feel the pulse. Review with your partner at each spot, which level of the spine are you at? Because you need to know that. Are you at C3, C4? Just review that. So while they're supine, you're going to find the sternal notch. Then from the sternal notch, you're going to walk your way down because you're looking for the junction between the manubrium and the sternum. So there's a little spot here at the top. And then there should be a ridge right between those two. And the reason they call it the angle of Louis is because you have the manubrium and the sternum kind of form an angle, like this. And it's that measurement of that angle between those two. So it's not flat, it's kind of protruding just anteriorly. So if you see the picture I posted, you can see if you put two like sticks there, it does form a little bit of an angle. So find the sternal notch, work your way down and just kind of palpate and then push on the skin and just slide. As you slide, notice when in the AC joint you went too far and then slid back up. It's kind of the same thing. Go about halfway down and then slide down and you should feel you'll come up against a ridge there. That is a location that you can use for finding the second rib. Because the second rib, if you go off the side there, that should be the location of the second rib as it comes in. All right, we'll come around and help you with that. Today we're definitely going to make sure we clean the tables really well. And we're done. So now we're going to palpate the structures we talked about in class, which would be the spinous process and the transverse process. So you want your patient or your partner in prone, you're going to come onto the sides here and you're going to pull up just gently on the skin of the neck. If you don't do that, the problem is you put your hands in the side, and then when you palpate, you push down, the skin becomes a little tight and you have to push the skin. So using the fingers of your hands, pull up just slightly on the skin to give some slack. Then you're going to use your thumbs to palpate right on the spinous process as you go down each segment. Do we have a spine? I don't think we have a spine. So you're going to take up the slack. My fingers, what? Yeah, finger.
Downstairs?
Yeah. You're going to pull up the slack, put your fingers, do you see my fingers right central, right on the spinous process, and you're just going to gently push down towards the table. The first one that you're going to feel is most likely C2. C1 is buried fairly deep, and the skull hangs down, and so you can't quite palpate that. At least for now, we're going to stick with that. So you're going to be on C2. Now remember a couple of things. When he's laying on the table, if I have the table this way, he's in extension. And imagine that up here, we'll go this way, find the most prominent spinous process you can see in your partner. Go and try it. The most prominent one. Okay, so find the most prominent one. So you put one finger on the prominent one, then put one on the spinous process that's right above it. The most prominent one should be C7. The one above it should be C6. The way you're going to tell is if you extend, the one above should disappear. That is C6. If you go back to flexion, you'll feel it again. If not, then move down one and see maybe the most, like his are both very prominent. So I move down one, and then if I extend them, it definitely doesn't disappear, so I know that's the wrong one. So then I move up the second. So the most prominent one is C7. The one above it that disappears when you go into extension, that is C6. And that's just a way for you to find the spinous process. If you want, when you're practicing, you can find that and put like a pen mark on C7. Then when they're in prone, you can do your palpations and just kind of see if what you feel in prone is about what you found in this one. Because this is a lot easier to find where you're at, as opposed to now you know. In prone, it's very difficult to tell where you are exactly. And for right now, you just need to know generally where you are, and you can practice, get more specific at that. Let's see, do we have any more? Oh, superior nuchal ligament. So if you flex them down a bit, just lightly put your fingers on the spinous process and just go back and forth here. You're going to feel a very firm ligament all the way up and down, whereas if you extend, you won't be able to feel it quite as well. So just slight flexion, use your fingers lightly on the skin, just move the skin back and forth over the spinous process and you'll feel a very tight ligament there. Good? All right, let's switch. I know some of you have been switching already, that's fine. Can be a little tricky. So find the mastoid process on the sides here. I'm going to use my second digit. So find the mastoid process. I'm going to go just inferior to the mastoid process. And if you go just inferior and then take your elbows out, like both of them together, your finger will push right on to C1. It's not comfortable. So mastoid process, just slide just inferior. So I'm behind the angle here at the mandible. And I'm in front of slightly I'm in front of, just slightly in front of the SCM. So right in that spot right there. And if I have him side bend or turn, you can feel the bone kind of move underneath your finger. So that's transverse process of C1. We'll come around, that's a hard one.